This video is for full wax evaluation. So brow, lip, underarm, bikini, all of legs. So what we're gonna do is we're gonna start as if we just arrived at work, and we're gonna wash our hands. So we will go to the sink, wet our hands, get liquid hand soap, coin size amount, and we're gonna wash our hands together down to the wrists. We're gonna wash the back of our hands down to our wrist. We are gonna wash our fingers and the backs of our fingers, of course. We are gonna wash between our fingers. We're gonna wash between our fingers and our thumbs. We are gonna wash our fingertips and nails. We are gonna wash our thumbs. We are gonna wash our wrists. And we're gonna do all of this proper wash, for a minimum of 20 to 30 seconds. And then we will thoroughly rinse everything underneath the water. And when we feel like we have had that proper rinse, we are gonna grab a disposable paper towel or clean towel, turn the faucet off, completely dry the hands, and throw the disposable paper towels in the trash. If it's a clean towel, it's now dirty, and it's gonna go in a closed container labeled to be, or not labeled, but just until we do the laundry. So we're gonna grab our hand sanitizer, 70% ethyl alcohol, to finish our hand wash before we prepare our area for the wax services. So we are going to disinfect our workstation, our bed, and equipment using a disinfectant wipe and following manufacturer's instructions. We're going to check our equipment to ensure that all devices are in safe working order and plugged into a working receptacle. We'll gather clean supplies needed for the facial service, storing in a clean closed container. We're going to dispense products needed for the service. We're going to prepare disposable portion cups for each product with a portion of the product by opening the top of the container and ensuring the tip of the nozzle does not come into contact with the disposable portion cup tray, or remove the product with a disinfected or clean single-use spatula. We will close the lid to the product and set the portion cup tray on the tray. We will place disposable table paper. No, we're not. We're going to skip that because we're going to place, our client is getting everything done. So we're not going to be using table paper. We are going to set up our bed with a fitted sheet, a flat sheet, blanket if needed, a towel horizontally at the top of the bed. We're going to have a rolled towel to be placed underneath the neck for comfort. We're going to additional towel for the décolleté. We have a headband or hairnet. All the things that we need to do for someone that's having all kinds of things waxed, not just brow and lip. So that's a little bit different. And I want to show you that I have prepared my tray. And once again, this just expedites the process when your client arrives. So you're going to have everything set up and ready to go, and you have turned your wax on at least 30 minutes before your client gets here. So that's part of that whole getting here in time to prepare for your service. So we have cotton rounds 2x2s for squares always. We have wooden sticked Q-tips, and we have all different kinds of sizes of waxing spatulas, because we're going to be waxing all different parts of the body. We have tweezers, and we have small scissors, and the scissor in case we have to cut any extra wax strips, but that's why you want to be here early, so that you have all different sizes of wax strips already cut. We have water, just because we always do, and then we have our pre-wax solution. We have powder. We have our wax remove solution. We have our soothing step. And this is our wax, quote unquote, for the video. Just note that is our wax. And now we have to do our client consultation. And this particular client consultation is going to be a little bit more detailed or in-depth. Just because we're going to go over some more of contraindications and why doing the whole body. We're just going to talk about a couple of different things as we work through this. As you saw, when I got to work, I washed my hands and I did my whole area setup, but I will be washing my hands again before I start the service. The other thing that I'm going to grab that I didn't have on my tray, of course, is a pair of disposable gloves, because we always wax with gloves. So I'm just getting a new pair of disposable gloves. And I will, like I said, be washing my hands again. So I'm going to go and do my client consultation time. But note that I have clean hands. So just keep that in mind. So I'm going to read these things first, and then I'm going to get my textbook and go into a little bit more detail with some of these contraindications. But because this is, in this booklet, it's for brow and lip, and I'm just going to go into even beyond that. So we'll greet our client, escort them to the work area. We will assess the client's current style, determine the client's preferences, assess the client's needs, assess the client's skin by performing a skin analysis to ensure that there is no inflamed, infected, broken, raised, or swollen skin in the area to be worked on. That's where I'm going to take a pause. You can see their face. You can't see their underarm, their bikini line, or their legs necessarily. So that's why we're going to talk a little bit more in depth. Or an open wound or sore in the area to be worked on, infection or infestation, for example, lice, to prevent from safely performing the service. We'll assess the client's consultation form for any medications and products used within the last 72 hours and consult on any known allergies. I'm going to talk about that more in just a second. We're going to consult with client on any facial surgeries within the last 3 months, and if the client is under a physician's care. We're going to assess if the client is prone to cold sores or fever blisters. We'll talk about that a little bit more in a second. Assess if the client has used exfoliating or lightening agents within the last 72 hours, like alpha hydroxy acids, beta hydroxy acids, hydroquinone, etc. Talk about that a little bit more in a few seconds. And assess facial injections within the last 3 weeks, like Botox or hyaluronic fillers. So let's move to this textbook to get into detail. So we have to review any possible contraindications that may suggest that you may want to avoid this service for your client. So you really have to look over that consultation form and then make sure that there may be some contraindications like moles and warts that you're not going to be able to know about or will become more apparent only after working with the client and closely surveying the skin like you haven't seen everything yet. So if you notice something on your client, you could, that wouldn't be exposed obviously on the face, you can certainly note that on your client form, or if you have a software system like on the computer, you could note it there. For example, if there was a mole or something that you'd want to avoid. But just make sure that during this appointment today, if they did have a mole or something like that, you don't wax over it. You don't want to cause any irritation or spread virus or bacteria to other areas. So let's go over some more contraindications like skin conditions such as the ones I'm going to list. Varicose veins, those would be on the legs, back of the legs. Unusually pronounced moles or warts. Cuts, abrasions, wounds, open sores. Active herpes. Acne. Skin diseases or disorders. Sunburn. Rashes. Cysts or boils. If any of these conditions are present, do not perform the waxing service. It is important to be aware that herpes, in particular, even on your mouth, is highly contagious, and you should never perform a waxing service on a client who has an active outbreak. In addition, skin diseases that present visible irritation on the surface of the skin should never be waxed. Rash, anything, sunburn, anything, you should never wax it. The existence of the following health conditions may cause the client to bruise, swell, or experience excessive pain during the waxing service. In addition, conditions such as diabetes impair the healing process. So these health conditions we just mentioned, diabetes, if they have poor circulation, chemotherapy, radiation treatments, they do not need to be waxed. High blood pressure, no wax. Low pain threshold, clearly they don't want to be waxed. Or lupus. And definitely, lupus is autoimmune, but it makes the immune system fight against itself. So they can have lots of rashes. They're super sensitive to the sun. Major things can be really severe, such as nerve or brain dysfunctions. So they need to avoid waxing. Medications can cause the skin to become thin, fragile, and dehydrated. Do not wax while a client is on Accutane or even 3 months after they've been off Accutane. So they have to wait 3 months at least after taking Accutane. Instruct clients to avoid using Retin-A and alpha hydroxy acids for at least 48 hours prior to this service and after the service. So don't use any of that 2 to 3 days before and 2 to 3 days after. So oral or topical medications or treatments that need to avoid waxing. We said Accutane, antibiotics, cortisone cream, because remember we're talking about the skin becoming thin and fragile. You don't want to wax it. Retin-A, Renova, alpha hydroxy acid, beta hydroxy acid chemical peel. So now you know a little bit more in detail why you would have caution someone against getting waxed. And you not only want to be ethical and professional, you want to be really good to your client, take care of your client, and not hurt your client. So that is, if your client is free from those contraindications, then you can proceed with the service. And our client Sue is. So let's get her comfortable before we begin the waxing service and I wash my hands. So you would be giving this client privacy because they are going to be waxing their underarms, their bikini line, and their legs. They're going to be disrobing into a drape, and they're also going to be changing. They either have to bring their own bikini bottoms, bathing suit bottoms, or they can wear disposable underwear, which you provide, and they will throw in the trash when we're done with the waxing. So our client has put on her drape and her disposable underwear. Now we're going to get her comfortable. So I'm going to take a rolled towel under her head for more support, and I'm going to put on a hairnet. You can use a headband. You want to keep the hair out of the way of the client and away from the brow, etc. For this initial part of the waxing, we're going to do the brow and the lip. So I'm going to go ahead and cover her all the way up. So she's in the facial bed right now under the sheets. I've also put a blanket on her so she's warm. And I'm going to cover her up completely right now just to stay warm and also to prevent anything from falling on her skin. Wax, water, soothing gel, whatever. Nothing's going to fall on her, but we want to make sure. So she's comfortable now, and I need to wash my hands before I put my gloves on. So I'm going to go to the sink, wet my hands, get that coin-sized liquid hand soap, and I'm going to wash my hands all the way down to my wrists. I'm going to wash the back of my hands down to my wrists. I'm going to wash my fingers and the backs of my fingers. I'm going to wash my fingertips and nails. I'm going to wash between my fingers. I'm going to wash between my fingers and my thumbs. I'm going to wash my thumbs. I'm going to wash my wrists. I'm going to do all of that interlocking washing for a minimum of 20 to 30 seconds. And when I feel like I've done a really good proper wash, I am going to rinse them thoroughly underneath the sink. When everything has been rinsed, I'm going to get some disposable paper towels, turn the faucet off, dry my hands off, throw those paper towels in the trash, locate my 70% ethyl alcohol hand sanitizer, and I'm going to sanitize my hands. Once your hands are good and dry, you're going to be able to put your disposable gloves on. And once your gloves on, you're able to get in there and perform the service. I'm just going to take a quick sip of water. Sorry. My mouth is feeling really dry. Lots of videos. Okay. So we're going in here. And the first thing I'm going to do always with any area that I wax is I analyze the direction of the hair growth. So I'm looking at her brows first, and I'm just checking to see which direction the hair that I need to remove is growing in. We already talked about shave preference, and we've mapped it out, so we kind of know what we're going to do. I just want to double check that. And now that I know that, I'm just going to simply do that pre-wax solution to remove any oil or any makeup that might be on the brow area or around it. I'm going to get it nice and clean. And she is she's had everything waxed before a couple of times, so she's not new, but she's not like super experienced either. So she is something that she feels like she really wants to do on a regular basis. So I think that's great, because the more you wax, the better it gets, the thinner the hair gets, and the easier it gets. So I think it'll be great for her. So we've gotten everything removed, and we're going to now, I'm just going to dry it off, and then we're going to lightly dust it with a powder before I start waxing her brows. And you do want to make sure that everything's really, really dry. That's super important. You never want to wax on damp skin. So I've got just a little bit of powder. And everything's nice and dry. And now you're ready to wax. The first thing you always want to do is test the temperature on yourself. So that's what I'm going to do first. Is I'm going to take a little bit of wax here, and I'm going to try it on the inner arm, because that's a thinner, more delicate area. It feels great to me. And then I'm going to remove it. So for every wax client I have, I'm going to do it every single time. She's getting all the waxing done, so once I've done it once, I should be fine to carry on. But I'm going to check in with her throughout the procedure and make sure everything is feeling good. So let's go ahead and get some wax on these brows and get them off. So I'm just getting some wax on one side of my stick, and I'm wiping it off on all the other sides. Bringing it in at a 45-degree angle, and I'm going to let the wax come down, and then I'm going to spread it out. So I'm going to apply the wax in the direction of the hair growth. And then I'm even changing the direction that I'm applying that wax, because the hair growth changed. So I've gone with this direction, and then as it changed, I turned my applicator down because the hair is growing down. And then I'm going to remove it. And I'm going to apply my wax remover strip and then press it in the direction of the hair growth. And then I'm going to hold the skin nice and tight, and I'm actually going to remove the strip in the opposite direction of the hair growth. So I want the skin taut, and then I remove it and I press. And the pressing just helps take the sting away for the client. It's a little uncomfortable. This wax I'm going to remove in a different direction, because I applied it in a different direction, because our hair grows in a different direction. So I want the skin to be nice and tight, and then I'm going to remove it and press. And that looks pretty good. I'm going to go in and tweeze, but I won't have much to tweeze. Now I'm going to do the top of the brow on this side. She likes to remove the hair up there. Some people don't. She does. And I'm going to hold the skin taut, and I'm removing it in the opposite direction of the hair growth. going to the other side for the client. Holding the skin nice and taut. And now I'm going to go to the top of the brow on this side. Skin nice and tight. Tight skin, press. A little bit to tweeze, once again, nothing major, and then we need to go between the brow, the midsection of the brow here. And I'm going to hold this brow skin as tight as I can, and I'm going to pull up towards the hairline, keeping it close to the forehead. So pretty good there. Let me throw away these extras here I just used for the other side. Okay, so what we're going to do is we are going to remove any wax residue, obviously. And then I am going to tweeze anything that I might have missed, which was not a lot, thankfully. And when you tweeze, you remove the hair in the direction of the hair growth. Good. So now we can move forward and move on down to the lip area. So once again, I'm going to analyze the direction of the hair growth. No surprises here. She doesn't have a very thick upper lip hair, but she does have some that she wants to remove. So let's prepare the area with some pre-wax solution. Oh, wait. before we do that, let's soothe these brows. Can't forget to soothe. Just ready to carry on waxing. I forgot to do this part. All right, now we can do the pre-wax on the lip. So we're going to take care of this, and then we're going to, of course, dry and powder the lip area. Light dusting of powder, which just mattifies it beautifully, so there's no residue of any oil or moisturizer or makeup. That's the key, is that you want to make sure that it's void of all of those things, and then it's nice and dry. So any last bit of moisture is gone, and now we're able to get in here and wax that lip. Applying that wax in the direction of the hair growth. And then I'm pressing that wax strip, of course, same concept here, so that it is being pressed in the direction of the hair growth. I'm going to hold the skin nice and tight, and then I'm going to remove in the opposite direction of the hair growth. And I'm checking, yes, we got the hair. That's great. Nice tight skin. Pretty good. Let's go to the other side. And this kind of area is a little ouchy, so I'm going to try to get, I try to get it done as fast as possible and as clean as possible, so I don't have to tweeze that much, etc. Try to make it as painless on the client as possible. Holding that skin nice and taut. And then we've got one little area here in the center of the lip that is kind of hard to do, up to the nostril and then right in between there where she does have some hair and it's growing down. So we want to make sure we get that area. Sometimes I say do this where you flatten it out, you have them put their tongue underneath that area, and it helps a little bit. And I'm going to hold the sides of the lip to try to flatten it out and keep it tight. Now it's hard to go straight up with this or straight back with this close to the skin because the nose is in the way, so just be quick. Not bad. So let's do a little remove, get any wax residue, and then I'll tweeze what I need to tweeze if there's anything left that the wax didn't get. almost done. Perfect. All right, let's soothe her because this poor girl has so much more waxing to do. That feels better, I'm sure. Get that soothing lotion on there, calm it all down. And then, of course, you would show her the results. And you're going to carry on and move on. So what we're going to do now is we're going to move to underarms. So we're going to go ahead and change this towel position. She has her drape on, and so I'm going to get my textbook here so that we can go through each thing. So I'm going to kind of verbally coach you through the next bit, because this mannequin is only from here up, so we don't have any arms or limbs to show. The most important thing now is that we're going to assess each area as we go along. So she's draped appropriately. The only thing that you're going to have to do is make sure she's warm and comfortable, which she is. You already have all your stuff on. So you're going to have her take one of her arms out behind her head, like with her elbow wide. So hand goes behind the head, elbow wide. So you don't want it to be like flopping. It'll help. And then you just check if she's comfortable in that position so that you can keep it out wide and you can see what's happening right here. So you're going to get in there and you are going to assess the direction of the hair growth carefully. It's very common for the hair in the underarms to grow in several different directions. If the hair does grow in several different directions, always apply the wax to each section in the direction of growth and remove each section in the opposite direction. So it won't be like one big swoop of hair removal. You got to get in there and analyze first. So once you've done that analysis and you know the direction of the hair growth underneath the arm, you will apply that pre-wax solution, and that's going to remove any residue of body lotion or deodorant. Super important. And then you're going to go back with that lightly dusting of powder to remove any last trace of oil or moisture. Then you'll obtain the wax. I don't have to test it on myself because it's the same client. You're going to dip that spatula into the wax pot, wipe the side, back, and tip until a thin coat of wax remains on one side only, and you'll apply the wax. Excuse me. You will hold the spatula firmly at a 45-degree angle. Place the tip on the skin. Let the wax run down the spatula. Spread the wax as thinly as possible over the desired area, and remember to apply the wax in the direction of the hair growth. Checking in to make sure that they're comfortable, and then you'll throw that spatula away, of course, grabbing your removal strip. You will apply the removal strip of fabric. Make sure you have an edge to fold over that you'll use as a grip, and smooth the remaining portion over the wax. Press and rub that strip a few times, and then you're going to pull the skin tight. So let's say, for example, this is my strip. This is my underarm. This is my strip. This is the direction of the hair growth. So I'm going to press this way. I've got a little grip at the end. I'm going to hold the skin really tight, and then I'm going to remove it going in the opposite direction, staying as close to the skin as I possibly can versus up and out. And you're going to apply pressure so the client can relieve some of that stinging. And you'll check that strip to make sure that it got the underarm hair before you throw it away. So check in with your client, make sure they're okay, and then we're going to repeat the process. So you're going to go in every direction of hair growth. You would be applying a wax there, so that would be a different section that you would remove. You're going to want to work quickly in this manner throughout the underarm, and then you're going to repeat all of that on the other underarm. So we're going to go to the other underarm. We're going to tuck this arm in. The other underarm is going to come out. Hand's going to go behind the head. You're going to do your analysis of the hair direction growth. You're going to use your pre-wax, and then you're going to lightly dust some powder to make sure there's no oil or residue left. And you're going to work in sections to remove the hair, applying the wax in the direction of the hair growth, removing away from the direction of the hair growth, trying to keep that strip as close to the skin as possible, and then pressing down after you've kept it nice and tight when you remove. Press down on the skin to relieve any stinging. Once you've done that on both underarms, you can do the remove the wax residue step and then tweeze if there's any hairs remaining. And then apply the soothing gel on the underarms. So I'm just going to note this here. It is not uncommon for newer underarm wax clients to bleed slightly from the follicles since the hair in the underarm is often very coarse and dense. Bleeding will cease with continued waxing as hair thins and becomes sparse. That's why we wear gloves. And so her underarms are done. We're going to move forward and progress down towards the bikini area. We're going to do bikini and then we're going to finish with legs. We're going to work head to toe that way versus trying to do the legs and then the bikini. Her legs may be a little tender, and this way we can go bikini and then legs and she's gone. So we're going to do the classic bikini wax. We've already got our gloves on. We're already clean. Now we need to talk about the drape of the client. So the client has on her drape, and she also has on the disposable underwear that we've given her for the service. So we're going to ask her to bring out one leg in that butterfly position. So one leg straight, one leg's going to come out of the sheet, and you can place the foot up against the leg if that's good. And you're going to tuck in the sheet. So this is my bikini area, let's say. Tuck in the sheet all the way around. And you will be able to analyze this area then, which is your bikini area, for hair growth. So you've tucked the blanket all the way around and you're checking that the client is comfortable. They will be. So once you know the direction of the hair growth, because a lot of times it grows in different directions, you'll be able to dissect the sections that you're going to work in. And obviously you're going to be doing that based on the direction of the hair growth. You will apply your pre-wax solution to that bikini area, the entire area, to remove any residue of body lotion. Then you're going to apply your powder to make sure that you remove the last trace of oil or moisture. You're going to obtain wax. I don't have to check it on myself. It's the same client. You will dip a narrow spatula into the wax pot, wipe this side back and tip until a thin coat of wax remains on one side only. Apply the wax, begin on the upper thigh, so the highest part of the bikini area. Holding the spatula firmly at a 45-degree angle, place the tip on the skin, let the wax run down the spatula. Then spread the wax as thinly as possible over the desired area. Remember to apply the wax in the direction of the hair growth. Throw away the spatula. So then you're going to apply the removal strip, taking a narrow strip of fabric, fold over an edge so that you have it as a grip. Smooth the remaining portion over the wax, then press and rub the strip a few times. You need to pull that skin taut with one hand, and the other hand you're going to remove the strip quickly in the opposite direction of the hair growth. Try not to pull the fabric straight up. You're going to try to keep it in line with the skin, close to the skin as possible. Then you press on that area to take away this momentary stinging sensation. You're going to repeat that procedure on the new area, and you're going to work inward toward the panty line in this manner, then along so working in toward the panty line, then along the panty line. Draw the knee up slightly as the work progresses. So they might have started here, then the knee will go up, up, and up, so the foot will come out. You're still completely covered here. Ask the client to help by holding the skin taut with her hand if needed. Work around and along the panty line toward the back. Switch the leg positions when the entire area is clean so you can repeat on the other side. So you're going to work in toward the bikini, along the panty line to the back, and then you're going to switch legs. Once you've done all the other side exactly as you've just done that side, you can then use that wax remove. So if there's any residue, you'll take care of it. Then you're going to use tweezers to remove stray hairs. You can apply soothing gel or medicated lotion to the entire waxed area and show the client the results. Same as the underarm, it's not uncommon for newer bikini wax clients to slightly bleed from the follicle since the hair is coarse and dense. Bleeding will cease with continued waxing as the hair thins and becomes more sparse. It is important and necessary to wear protective gloves since exposure to blood is possible. And then let's go down one more to the legs. So now you're going to go to the legs. And I said differently in the other video. I think if she's already on her back, you've done her bikini, you might as well do the front of the legs, flip her over, and finish with the back of the legs. That way you're saving time and you're not flipping over and flipping back over. So making sure that you've got your client draped appropriately. What you're going to do now is cover her up so that you just have the legs out, or you can even do one leg at a time. Start at the top of the thigh and do that leg, cover the other one, do that leg. Probably a little bit more modest that way and probably nice. So always you're going to drape that client appropriately, and you're going to assess the direction of the hair growth. If the hair grows in several directions, you of course are going to always follow the hair growth direction to remove each section. So you're going to apply it in the direction of the hair growth, you're going to remove in the opposite direction. So once you've analyzed, you are going to apply your pre-wax solution, because it's going to remove any body lotion that might be on your client, and then you'll follow with that powder because it will remove that last little bit of residue of oil. You'll obtain your wax, dipping a spatula into the wax pot. You're going to wipe the side, back, and tip until a thin coat of wax remains on one side, and then you're going to begin your to apply the wax. And if you're doing the front, you're going to be doing it at the thigh. So I want to talk to you about that, the upper thighs. The skin on the upper thighs tends to be loose, so extra care must be taken to keep the skin taut while removing the fabric strip. Be cautious never to wax with one strip over the inner bone located at the top of the leg to avoid bruising when the strip is pulled. Always apply the wax in two sections in this area. So make sure that you're gentle and that you hold it really tight, the thigh really tight when you're doing the remove in the opposite direction. So you're going to do the front of the legs, and you're just going to work your way in sections. When you have the knee to do, you can have them bend the knee, leg slightly so that you can get the knee really good, because if it's flat, you won't be able, the skin won't be stretched, and you want that skin nice and tight. If it's this way, the knee skin will be loose. Keep that in mind. And then you're going to do all of the front, and then you're going to go ahead and do your wax residue remover, and you're going to do your tweezing if needed. You're going to do your soothing. Then you can allow the client to turn over, and you're going to start over. You're going to analyze the growth of the hair on the back of the legs, calves, everywhere, and you're going to work in sections based on the direction of the hair growth. Pre-wax solution, remove all the residue, any body lotion, any oil, little bit of powder to completely dry the leg. Then you can start in those sections. You're going to apply the wax in the direction of the hair growth, place the strip on, press firmly into that wax in the direction of the hair growth, hold the skin tight, find that grip, remove in the opposite direction, press to relieve the stinging sensation. And you're going to work your way all down the back of the legs. And then you're going to do any remove, post-wax remove. If there's any residue, you're going to tweeze if needed, and you're going to soothe to finish. Then you're going to show your client your results. Once the client has seen the results, she's going to be super happy, and she's been here long enough waxing. She's definitely ready to go home. So when you're completely done with those legs, you'll be able to remove your disposable gloves, and you'll be able to get your client checked out and taken care of. So let's talk about what happens in that step. And it does take a minute here for me to get these gloves off sometimes. So your client did completely disrobe pretty much for this service. She had to put on a drape, and she had to put on disposable underwear, or she would have brought her bathing suit bottoms from home. So what you're going to want to do is give her some privacy and allow her to get dressed. So you can remove the headband, and then you're going to leave her in this private room with the door closed so that she can dress, and then she'll come and meet you to discuss maintenance and aftercare. Some people, when they have the bikini and some larger areas waxed, they are concerned about things like ingrown hairs. So you're going to want to make sure you update her and tell her to exfoliate on a regular basis, maybe after a day or two, using a loofah or a similar sponge within the shower. You can also do alpha hydroxy acid or glycolic acid lotions or creams 8 to 12 hours after treatment to promote cellular exfoliation at the opening of the follicle. Also encourage her to keep coming on a regular basis because it thins the hair, and that might help prevent ingrown hairs. And you can recommend any other lotions or retail products you think would keep the skin soft. And then you're going to go ahead and get her booked for her follow-up. That way that she's in the process and really doing a great job of hair removal and moving forward to like getting used to it, making it easier for her to deal with and keeping her more comfortable. So that's great. So let's talk about, you've got her taken care of, and that was a super long service. She was really grateful for that. Let's talk about what we need to do then to finish this service. So you would get back to your room, and if there's any single-use items that have not yet been discarded that you use, you're going to go ahead and do that. You would, of course, grab your implements, things like scissors and tweezers, and put them in a closed container labeled to be disinfected. You would get all of your sheets, your bedding, your towels, your linens, and you're going to put them in a closed container until it's time for laundry, and then it's time for you to completely clean this work area. So you have to find a proper cleaning agent, read the manufacturer's directions, follow the manufacturer's directions for mixing and usage. You're going to wipe down your workstation and area with a cleaning solution to remove debris. You will then identify a disinfectant that is bactericidal, virucidal, fungicidal, EPA approved for use in a salon setting, which means you need to get another pair of disposable gloves, put them on. You'll follow manufacturer's directions for mixing and or using appropriate aerosol disinfectant. You're going to disinfect electrical equipment, store it in a clean area separate from other implements. If you're done for the day, you need to turn your wax pot off. You need to remove your gloves and throw them in the trash. And then you need to wash your hands to finish. So you've got to get to the sink, wet your hands. You're going to find that liquid hand soap, and you're going to wash your hands all the way down to the wrist. You're going to wash the back of your hands down to your wrist. You're going to wash your fingers, and you're going to wash the backs of your fingers. You're going to wash your fingertips and your nails. You're going to wash between your fingers. You're going to wash between your fingers and your thumbs. You're going to wash your thumbs. You're going to wash your wrists. You're going to do all of that interlocking wash for a minimum of 20 to 30 seconds. And you're going to do all of that until you feel like you're thoroughly clean. Then give it a good proper rinse under the water. You'll grab some disposable paper towels. You will turn the sink off with that. Dry those hands off with the disposable paper towels, and you're going to throw the paper towels in the trash. You will then find your hand sanitizer that is 70% ethyl alcohol, and you're going to sanitize your hands. And only when you've done all of that will your hands be clean, and you'll be finished with your service, and you can move on to the next one. So this concludes full evaluation for waxing from brow, lip, underarm, bikini, and full leg wax.